And welcome to the Doctor is In here on the WKRG Facebook page. Dr. Rachel Hunter is with me today from USA Health, and we're talking about benign breast problems. And this is different. Sometimes we talk about cancer. This is not about breast cancer. This is about everyday common problems women can have.
That's right. Yeah, so, as I had stated earlier, I talked a little bit about fibroadenomas. I'd probably say the second most common thing I see is breast cysts and breast abscesses. So,
and what do those entail? I mean, how do women find them? What are the symptoms? What are the signs?
Yeah, so sometimes they may get identified on a breast exam by your primary care provider, or maybe the patient feels it themselves when they're doing a breast exam at home. Other times it's found whenever they go in for a screening mammogram, and it just happens to be an incidental finding.
Obviously there are signs, soreness, I think like that is mostly internal, right?
Right, so sometimes patients will be symptomatic from these type of benign masses or cysts. They can cause breast pain, breast tenderness. A lot of times the cyst will cause focal pain where the cyst is. I like to basically refer to cysts as fluid-filled sacs. You kind of think of them as like a balloon. So they can fluctuate in size. Typically they fluctuate depending on hormones and patient cycles, and so they can increase in size and then involute over time. And when they're larger, that's when they typically will cause breast pain.
All right, we're going to continue. We've got much more to talk about, but I want to remind you that it's your opportunity to send in your questions here on our Facebook Live with Dr. Hunter while she's here, and we had just a few more minutes to talk with her about that. So go ahead and send us your questions if you're watching right now. Tell your friends who may be interested in this. You can message them and let them know, hey, we've got a doctor right here talking about benign problems here. Now, when you run into some of these problems, how common is it?
It's pretty common. So, as I said earlier, 10% of the female population has fibroadenomas, and that kind of goes for breast cysts as well. Abscesses aren't as common. We do typically see them in women who are lactating, and so they're prone to ducts being clogged. And then in our women that aren't lactating, sometimes breast abscesses can just be one of those things that unfortunately comes about, and it's not anything they did to provoke it oftentimes.
When we talk about discovering that they're there, I know it's got to be a little bit of a scare for some women, but you're there to go, no, this is nothing serious.
That's right. So, I mean, a lot of times women come in thinking that they have found a breast lump that is cancer, and so, our first thing to do is to rule out that it's not cancer. And once we've done that, I think a lot of the anxiety goes away, and once they realize that, hey, this is just something benign, oftentimes it doesn't require an intervention, there's a huge relief. So
that's good. As we kind of talked during the break before we came on and after our chat on WKRG News 5 at noon, but you had said these are problems that can affect men as well. Yeah,
so there are a few benign breast diseases that can affect men, in particular a condition called gynecomastia, where there is actually, it's not just, some men just think, oh, well, I've got fatty chest or something, but sometimes there actually is breast tissue in there. And when they have that and they want something done about it, we can excise that. Other than that, men can also be affected by breast cancer. So those are kind of the two things that we see most often occurring in men when it comes to breast disease.
As we talked about earlier, these are problems that can range, I'm assuming, from mild annoyances to full-blown, I'm in pain, we've got to get something done about it. So give me the degrees of separation from some of these.
Yeah, absolutely. So some women, it's just kind of a every once in a while thing, or maybe it's just a discomfort. For others, it may be, I'm in pain right now, especially in our breast abscesses, where maybe they tried to take care of it at home, put off coming to the doctor, and then it really progressed to a real flare and problem that can be excruciating and require sometimes pain medication to relieve it, in addition to an intervention like surgery.
Now, and going from lesser to more, let me go down to, you mentioned pain medication just to
Right.
kind of relieve the ache or the soreness or something like that. Are there other medications that could reduce inflammation, that sort of thing?
Yeah, so if there is inflammation involved with the etiology or pathology that's going on, we'll do things like, Tylenol, ibuprofen, kind of start with those before we progress to a narcotic. Warm compresses, things of that nature, wearing a supportive breast garment like a sports bra, all of those things can help reduce the pain.
Right. Okay. So now we're edging up the scale here. We've got drugs you can take, pain
Right.
relief, but let's say somebody comes to your office and says, "This has been going on for 2 or 3 weeks now. I'd really like something to do, get done about it."
Yes. So if we're talking about a breast cyst, what we do is we do a cyst aspiration. That's where we put a needle in the cyst and just aspirate that fluid out. Some women have to have these done serially throughout the year. Others, they may just have it a one-time thing and it never becomes a problem again. In terms of a breast abscess, we do oftentimes aspirate those as well. If they're really large or starting to kind of come through the skin, and I think of an abscess like a large pimple or boil, if you will. They usually have pus in them, and sometimes we do actually have to take those patients to the operating room, open them up and make an incision, and then it requires packing afterwards. We try to avoid that. That's not a pleasant thing that patients want to have to deal with is packing a wound at home, but sometimes that's what has to be done.
That's what you got to do.
Yeah. Plus antibiotics, of
right.
course.
And to take care of it. Okay. Earlier you went through some of the more common, what are the most common things? And the follow-up question to that, I'll go ahead and ask it, are there any specific causes to some of these things? Do they just develop, or is it a matter of perhaps wearing a bra, not wearing a bra, that sort of thing?
Right. So, unfortunately, a lot of this is just run of the luck, or bad luck, I should say. If your mother or sisters, they all kind of have, I like to call them busy breasts. They've got cysts, they've got dense breast tissue. They've been told that when they have a mammogram. The chances are of you having those things are pretty high too. But otherwise, sometimes it's just unfortunate that about happening that happens when women have these. I will say that we do know that women who smoke do have an increased risk for recurrent breast abscesses. So if I ever see a patient in clinic and she has a breast abscess and she also is smoking, I tell them the first thing she should do is try to quit smoking. It just helps, or smoking prevents blood flow, good tissue perfusion. It causes wound healing problems, and so these patients just are never going to completely heal their abscesses and their wounds. It's just going to be a continuing, frequent, recurrent issue for them.
Well, and that brings up a good question. One of our viewers asked, Lindsay's asking, if you leave these alone, let's say you just live with them, you don't go to the doctor or anything like that, would they progressively get worse?
Well, if we're talking about breast cysts, no, but they may be a persistent problem that you just have to deal with during your lifetime. As women start to, once they reach menopause and the hormone levels start to go down, those symptoms become less frequent, less bothersome. Now, in terms of a breast abscess, that's usually something we can't just leave alone. Oftentimes we can just treat it with antibiotics and, like I said, doing a little needle aspiration in clinic, which isn't a big deal. But it's when you don't do something about it, you don't get antibiotics, you don't do early intervention, you're going to have a much bigger problem on your hand in terms of a wound and healing a wound later on.
You don't want to, I hate to use a country word, but don't let that fester up.
That's right. Absolutely. Don't let it fester.
You're going to need something.
It's better to go in sooner rather than later. And, I always try to encourage people I can get you in soon, and I'd rather you do that than be sitting in an emergency room with this problem. So happy to as soon as I hear that a patient has a breast abscess, I try to get them seen the same day.
Well, that does bring up a point, and that is at what point do you make that decision, I need to go see a doctor?
Yeah, I'd say, if you've got pain, redness, swelling that is persistent after 24 hours, maybe you tried the hot compresses, you tried some Tylenol, it's not going away, I would see somebody then, you know, especially if it's Friday and you're going into the weekend. Try to get that seen before you really Monday rolls around and you've got a bigger issue on your hands.
By the way, we're talking to Dr. Rachel Hunter here on WKRG's Facebook page about benign breast problems, and it's a thing a lot of women apparently face because you're in business for that very thing. And I asked about causes earlier, but I'm thinking about like normal skin type problem causes like you know, acne, clogged pores, all of those types of things. If you, maybe you're a sweater, you sweat a lot, or you know, as opposed to somebody who doesn't. Are all those, can they be contributors?
You know, yes and no. I would say that women who are prone to sweating, or maybe they have larger breasts and it's hard, especially in, you know, Mobile and the humid, hot summer heat. Especially those skin fold areas, they're prone to be nidus for, you know, fungus and infection, and so you always definitely want to keep yourself clean and dry as best you can. You know, if you go in for a workout, shower afterwards, change your clothes, things like that. Try to keep damp stuff off of those areas. That's kind of the main thing, and then you know, sometimes an insect bite can kind of be a precursor to like an abscess.
Right, yeah.
But sometimes I will say, you know, it's just one of those things that happens in somebody that they've been doing all the right things and it just happened to them, so.
No rhyme or reason.
That's right.
A couple of minutes left here on our chat, and I want to get back to kind of recap some of the things we talked about, and that is some of the types of maladies that women might experience, and you described several different types from cysts to other things. What are they again?
So fibroadenomas, you know, the most common benign breast mass that we see, so that's an actual mass. Breast cysts, which are just fluid-filled sacs, oftentimes they're benign. They can have debris or some solid components to them, and in those cases we would be more prone to biopsy them earlier to rule out cancer, but most of the time cysts are completely benign and require either observation or needle aspiration. And then breast abscesses, which typically start with redness or swelling of the soft tissue, the skin, and can progress further to an actual fluid-filled collection behind the breast that requires either needle drainage or surgical drainage with an incision.
And we'd like to talk about prevention, and in cases like this, in some cases there's just no way to prevent it or predict it.
That's right. You know, unfortunately, especially with breast cysts, there's really not much you can do. Some women are just cyst formers and some aren't. And I think just knowing, the most important thing is kind of knowing what your baseline is, especially you know, moving forward throughout a patient's lifetime, and kind of knowing what their baseline breast exams feel like, so that when there is something new or a change, they can alert their physician to it sooner rather than later. I
do know from a certain amount of experience with a cyst that you talked about, the sac that is in there that has to be excised, maybe has to be packed. If you find a woman who is having this, had it before, it goes away, had it before, but it keeps popping up in the exact same place, you really want to get that taken care of.
That's right, yeah. Anything that's recurrent, happening over and over despite kind of the same intervention, that can be very cumbersome and frustrating for patients to deal with. So sometimes we do have to take it to the next level and do, you know, a full excision of that area. We try to not do that, of course, because anytime, you know, you make an incision or you're excising breast tissue, you worry about leaving a cosmetic deformity, but ultimately, you know, that disease has to be removed if they keep having problems.
There you go. I tell you what, it's annoying, and you know, obviously going to be time consuming because they're going to have to come see you and get it taken care of, and you are with USA Health. Tell people how to contact you.
All right, so they can contact us by, if you go to our website, and there's actually a appointment page there where you can fill in your information, and there's a phone number to call us. There's actually, once you put in your information, it sends an email basically, or sends a message to us, and somebody gets in contact with you to help you set up that appointment quickly.
And you mentioned you can get people in pretty quick when they have something like this.
That's right. Yep. I actually have clinic 3 days a week. I have clinic Mondays and Wednesdays here at our Strata Breast Center in Mobile. And then I also see women in Fairhope on Thursdays at the Mitchell Cancer Institute clinic there close to the courthouse.
All right, so convenient and quick as well. That's Dr. Rachel Hunter from the USA Health, and we're talking about benign breast problems. We're going to save this on our WKRG Facebook page. You can go back if you need more information and listen to it and watch. And if you've got a problem, I would call Dr. Rachel Hunter at USA Health. Thanks for watching.
Thanks for having me.